Hi, let's talk about the veins of the superior mediastinum and the root of neck. So, all of the veins from superior to the diaphragm are going to drain into the superior vena cava, the SVC. That superior vena cava drains into the right atrium along with the inferior vena cava, which drains the veins inferior to the diaphragm. That superior vena cava is the nexus between two brachiocephalic veins, a right brachiocephalic vein and a left brachiocephalic vein. The left brachiocephalic vein is longer and more oblique than the right. It crosses over the superior mediastinum, whereas the right is more vertically oriented and shorter. Each of those brachiocephalic veins is the union between the internal jugular vein, IJV, and the subclavian vein. So what I'm circling is a region known as the venous angle. And the venous angles are significant because it's here that lymph from the body drains back into the cardiovascular system. On the right side, there's the right lymphatic duct that's conducting lymph from the jugular trunk and the subclavian trunk and the right bronchomediastinal trunk into the vicinity of the venous angle. And on the left side, we have the thoracic duct, which is conducting lymph from below the diaphragm, that's also gathering that jugular trunk, subclavian trunk, and left bronchomediastinal trunk to return the lymph back into the vicinity of the left venous angle. Thank you very much for your time.